If you've found yourself with the itchy eyes and fits of sneezes this week, you're not alone. I've had it.
You had it badly, don't you?
Yeah, so my little boy too.
Experts have warned of a pollen bomb, which sounds quite terrifying, doesn't it, across the country, triggering hay fever sufferers due to the very high grass pollen levels.
Well, here with expert advice on how to stay protected, we're joined now by allergy specialist Dr. Helen Brough. Good morning.
Morning, Helen.
Good morning. Good morning. So both myself and my little boy, we found out the other day, actually, we're allergic to grass. And it's both different types of grass, and apparently June is the moment. This is why there's this pollen bomb going on.
Yes, absolutely. I see so many people who are really suffering at the moment, especially teenagers, because they have a particularly bad hay fever when it comes to their exam period, which is really unfair.
And it's terrible because I've been reading statistics about it, and it actually says that people who have hay fever and are studying for exams, actually their exams can drop by 20%.
Absolutely, yes.
Not just because of how they feel and the symptoms that they've got, but also the medication that they're taking.
Absolutely, and that's a really important point. So we always recommend non-sedating antihistamines for both children and adults, because if you take a sedating antihistamine, it's not great for your brain when you're asleep because it actually impairs how you learn. So it's really important to take non-sedating antihistamines.
Cool. Let's come on to those in just a moment, if you may. I fortunately don't suffer from hay fever, but a few of my friends have developed hay fever in sort of later life. They didn't as kids, and they've got it in later life. But just take us back, if you can, Helen. I always assumed hay fever and the phrase hay fever came from people getting a fever from hay initially, but that's not the case?
It is a misnomer. Actually, having a fever is not what you usually get when you get hay fever, because you're having allergic inflammation of the nose and the eyes, and actually having a fever means you're more likely to be having a cold or a viral infection rather than an allergic inflammation of your eyes and nose.
So what can we do about it?
There's so much that can be done. A lot of it is non-medical as well.
OK.
So lots of simple, practical strategies for people to take on board, especially this week with this pollen bomb. So the first thing is when you are outdoors and you've been on a high pollen count day, like today, that you make sure that when you get home, you take all the clothes off and put them straight in the washing machine, and then you go straight in the shower and wash your body and your face and your hair. And that means that you'll get rid of all of the pollen from your face and your hair, and then you'll have a much better night's sleep, because otherwise the hair, which has all the pollen, will be rubbed into the pillow, and then you'll get the pollen in your eyes, and that can cause really uncomfortable eye swelling and can be really, really bad for people who suffer.
We had a question on that, actually. Claire says, can she use baby shampoo to wash her eyes? Because baby shampoo notoriously is much less sort of soapy, isn't it, and more gentle, but obviously Claire gets that irritation in her eyes.
Yeah, absolutely. So definitely it's worth washing your face and around your eyes. I wouldn't go inside the eyes with the shampoo, but there are other things that you can do to protect your eyes when you're outdoors. So you could wear a hat which has a wide brim. That means that the pollen will fall on the hat rather than on your face and eyes. You can wear wraparound sunglasses so that the pollen's not getting in the sides. And also you can put some barrier. So you could put just some petrolatum or some kind of ointment on your cheeks, and then the pollen will fall onto your cheeks and not go in your eyes.
Petrolatum, you mean like Vaseline or something like that?
Just Vaseline, yes.
And that gathers it, does it?
And so it will automatically get to this area instead of inside your eyes. And you can do the same on the tips of your nostrils, because then it will stop the pollen going inside your nose and causing the allergic reaction in your nose.
Right. And then if you were going to head down a more kind of medical route, what would you suggest you take? And what would be the combinations?
That's a great question. Again, there's lots of things that you can take which are over-the-counter medicines, and your pharmacist can help you with that. There's lots of non-medical things that you can use inside the nose as well. So there are some barrier gels and barrier ointments that you can use.
Okay.
And then I'd say that for mild symptoms, the first thing you would do is you would start with a non-sedating antihistamine, and a medicine that can be a syrup for children or can be a tablet for adults.
Syrup for children sounds good. I mean, I'm perked up straight away.
I like that. Yes, so that's what you can do, and you can do it ad hoc when you have symptoms, or if you have quite significant symptoms. Top tip is to start a few weeks before the grass pollen season, so maybe start in April, and then you're protected so that when the grass pollen season comes, what happens is that by doing that, all the receptors on the allergy cells get internalised, and then the grass pollen can't actually bind to anything, and you have much fewer symptoms.
There's a nasal spray there as well. I think you were talking about potentially putting some sort of cream or petrol jelly on your nose, but that's much more direct, isn't it?
Yes, so the first thing I would say, again, which is non-medical, is a saline rinse. So you can just use a saline rinse as many times a day as you like, just to clear the pollens out of your nose. And then after that, if you need to use medication in the nose because you have nasal congestion or because the antihistamines aren't working enough, they can use the nasal steroid spray, but it needs to be a non-absorbed steroid spray. So there are some that get more absorbed into the body and some that don't. And particularly for children that are growing, you need to pick the ones that are not absorbed, which are available over the counter as well.
And I wanted to ask you a question actually about the nasal spray and how you actually administer it.
Yes.
Because I was very much under the illusion that you kind of breathed in at the set, but you said don't do that.
That's right, yes. I have so many families who come to me who've been having all the medications prescribed, but they're still not getting any benefit.
And taking it wrong,
yes,
essentially.
Yes, exactly.
Yeah.
So if you go with the nasal spray straight up into the nose and sniff, you'll just swallow the whole steroid into the stomach, which is not going to help you.
So you don't press and inhale?
No, you need to.
I know, I read this and I was like, I've been doing it wrong.
Yeah.
Sorry, Helen, go on.
So head down, and then you angle the nasal steroid spray towards the side of the nose, and the nasal hairs will then slowly bring it back to where it needs to go. And then you don't sniff, you just hold a little tissue here if you need to, if there's any that falls out. But most of the time, nothing falls out. And that will then mean it goes to where it's directed. And it also means that you're less likely to get nosebleeds, because if you angle it towards this part of the nose, you're more likely to get nosebleeds.
Yeah, and you'd also got a top tip as well for if you're giving eye drops to children, because sometimes that's really...
Yeah, of course.
I have to, like, kind of try and wedge Milo's eyes open, but you've got a great tip for that.
Thank you for that. So, yes, they just need to lie down, have their eyes closed, and then you put one drop here and let it fall into their eye, and then one drop here and let it fall into their eye, and then they blink.
So let gravity do its work.
Yes, exactly. So you don't have to touch their eye at all.
Claire's been in touch. Jane's been in touch saying she's tried everything. Can my GP prescribe something stronger?
Yeah, there's always more that can be done for hay fever. What I would say is that the first thing is to make sure you're doing the basic things first, so allergen avoidance that we talked about, and then using the symptomatic treatments that you have here, which are correctly prescribed. Then there's immunotherapy, which can be used to actually reduce the amount of allergic symptoms and actually get to the bottom of the problem, which is your allergy to grass pollen or tree pollen. But in an emergency, what I would not recommend is the steroid injections, which are no longer recommended in the UK.
Okay.
They can prescribe a short course of oral steroids if you're really suffering and, for example, need to do an exam or something like that. Sometimes they can be prescribed, much safer than using the steroid injections, which are not recommended.
Okay.
And we do have these here. They look quite ominous. Would you sort of suggest the use of masks in some cases?
It's a personal choice. I think there's some kind of allergen exposures that are really high. For example, if you're mowing the grass, you may wish to wear one of these. If you have very severe allergic asthma that can be life-threatening, you may wish to wear one of these. But for milder symptoms, I would just recommend other forms of allergen avoidance, like the wide-brim hat, the wraparound sunglasses and the barrier creams.
Okay.
Helen, thank you so much. I'm still reeling from the
nasal spray. So was I.
It's like when Adam Peaty told me I've been doing breaststroke wrong all my life. You don't breaststroke that way, you breaststroke that way. Oh. Yes, I know.
I didn't know that either, Helen.
Adam Peaty,
wow.
Olympic legend, breaststrokes that way.
You're welcome. Thank you.
Thank you
very much.
Thank you.